So I guess it was it was June of 2014, I had found a lump and I was concerned in regards to um, what it potentially was. I went to one doctor, and the doctor said, "Well, you're 30, almost 31. You're too young for cancer. You're too young for breast cancer," and so they just kind of brushed it off. I really continued to feel concerned that it was still there in July of that year, and so I went to another OBGYN in Johnson City who was absolutely wonderful, took it very seriously. And he did an ultrasound and told me, I really feel very strongly we need to go and investigate this. So I'm going to set you up for a diagnostic mammogram. Well, I was in, 30. I mean, I'd never had a diagnostic mammogram. I wasn't even familiar with what that was. And so I went in, and they were really sweet in Johnson City. They did the mammogram, and a lady told me, well, we're going to also do another ultrasound. So brought me in, laid me down on the table, and went through with the ultrasound. The woman looked at me and said, we see something else. We're going to go ahead and set you up for 2 different biopsies. And she said, we're not only going to biopsy what you had felt, but there's something else that is deeper in the breast tissue. So we're going to go ahead and biopsy that and see, what it is. And so in August, we scheduled a biopsy. Early August, I was actually doing a 2-week doctorate of ministry program. I was in my 2nd year. So I drove up to Wilmore, Kentucky, and then drove back down for a couple of days to do the biopsy, and then drove back to Wilmore, Kentucky to finish up my 2-week residency. And so I went in. I remember when they did the biopsy, I looked at the nurse and I said, well, do the tissues look different? And she said, yeah, they really do. And I felt like something was wrong, but I just kind of hoped that maybe I didn't have any kind of cancer. Well, I came back in and they said that the lump that I had actually felt wasn't cancer, but the tissue, the thing that they noticed on the mammogram that was deep inside the breast was cancer. And so it looked very early, and they were going to refer me to an oncologist to move forward with surgery. We decided to go to UT Medical Center and kind of pursue that. The way I decided to go to UT Medical Center was because my mother was looking into different doctors, and one of the surgeons up there, Dr. John Bell, who was over the Cancer Institute, had good reviews, was really excellent, and so she thought, why not, let's try him. She got the Johnson City breast center to recommend me, or to give me a referral, and so we went and saw him around the end of August and had a great conversation with him. I love Dr. Bell, who's actually retiring at the end of this year, I believe, but I love Dr. Bell because what he did was he took out a long sheet of paper and he drew out everything and explained the cancer to me really well. He explained that based on the test, it was hormonal receptive, and so it was estrogen and progesterone positive, but it was HR2 negative. So it was a very fed by hormones, but it was also very slow growing, which was, good news, and everything looked really good, and it looked like the cancer had been really contained. And so, once we did the mastectomy, we were going to know at that point well, is it stage 1 or is there any concerns? And they were going to take the lymph nodes also to make sure it hadn't spread at that point, just as a precautionary measure. And so he did the surgery in October of 2014, and we talked about I was a good candidate for a lumpectomy, but I decided to do the mastectomy because I was concerned. My cancer was encased in something called a hamartoma, which is breast tissue in a breast, and I was concerned about potentially, being spread in other, places, or so I just felt like let's just go ahead and take everything, and I look back now and I don't regret that. We had a conversation about treatment, and one of the things that the medical oncologist he had referred me to, the first one, was wanting to do 4 rounds of chemo just as a precautionary measure. There was a test that Dr. Bell had suggested for me to have done on my tumor called a Oncotype test. And not all the breast cancers respond to that, but mine was a good candidate. And so when they did the test, it basically said that chemo was it really wouldn't be as helpful in this particular case, in this particular cancer. And so I opted out of chemo and did tamoxifen for a few years. And I have been consistently tested over the last 9 years. I go in twice a year, once for a breast MRI, and then 6 months later I go in for a mammogram and an ultrasound. And so far so good. The breast cancer has not come back. Some good questions to ask. I mean, for me, it helped me to do as much reading as possible. I know that once you're getting diagnosed with cancer, it's just a shock. And it was a horrible shock to me, especially in, my very early 30s. But I wanted to understand and to know as much as I could in order to prepare myself, as well as just kind of, not live in fear, because I felt like knowledge helped me tremendously to be able to move forward. So some of the questions I asked was just kind of, when we found out there was no evidence of breast cancer in me and everything looked really good, I asked about potentials of reoccurrence and, based on the surgery and the treatment, how would that benefit me in the future. So like, for instance, the Oncotype test I talked about, it showed how, with tamoxifen alone, I would have 95% non-reoccurrence of breast cancer. And with the chemo, it was like very, very, very little bit, like a 95.1%. So it was not really, it was not in my purview, and or it was not going to benefit me as much as just doing the tamoxifen and just continuously doing the routine checks and everything. Other questions I asked were, especially when I was trying to decide between a lumpectomy and a mastectomy, I asked in regards to treatment, and everything. Well, if we did a lumpectomy, would that add more treatment to it? Which in my case it would have. They would have looked at adding radiation to that as well. And because I did a full mastectomy with reconstruction, that was kind of taken out, especially because it was encased and everything. I asked about recovery time for the mastectomy with reconstruction, especially with the plastic surgeon. I asked a lot of questions in regards to the implant, and because you not only with the reconstruction, they don't just sit a silicone implant in you. They actually have to stretch it out with an expander, and that takes some time. So when you're thinking that, it's surgery and treatment and you're done like that, no, it's not kind of how it works. So asking those questions helped me tremendously kind of understand, okay, so this is kind of what my life is going to be like for the next few months, and to see what the ultimate goal was. The biggest advice I could give to anybody who has just been newly diagnosed with breast cancer is to do as much research as possible and advocate for yourself. There are wonderful doctors out there. I was very, very grateful and thankful for Dr. Bell, who was my surgical oncologist at UT Medical Center. My first medical oncologist, I'm not going to mention who that was, but he was not necessarily the best fit for me, and he was not willing to listen to concerns and questions I had. He was not very good at answering a lot of the questions. So I advocated for myself and got a new medical oncologist in the same area, but she was absolutely wonderful. Dr. Newman over at UT Medical Center. She was very patient, listened to my questions, understood my concerns, and I'm thankful for that. Advocating yourself really is doing research, talking to other cancer survivors. We don't want to talk about it. Cancer is a dirty word, but for me, talking to other cancer survivors helped. Reading a lot helped, and just being very knowledgeable. Because just because you have a diagnosis and a treatment planned doesn't mean necessarily that may be the way to go, and that's why you have to consistently ask questions. And if you want to get a second opinion, go get a second opinion. That doesn't hurt. Like I said, I'm thankful. I really had some great doctors who were very encouraging, and especially at the very beginning, just to advocate for yourself. Research, be educated on it, because in the end, that's going to help you in the long run. What is one word of encouragement that I could give to somebody who was newly diagnosed with breast cancer? I thought about that, and as somebody who is now going through getting ready to start treatment for endometrial cancer, which was not a reoccurrence of the breast cancer. I thought a lot about back at the beginning during my breast cancer journey, and being 30, now I'm 40, and just having those years of years of life experience. I struggled a lot when I first got diagnosed with breast cancer and went through the surgery. I had multiple surgeries for different things during that time, and the aspect of scars and how the surgeries changed your body. And that was as a young woman who was not married, was not in a dating relationship. That was very hard for me. And really hit my self-esteem for a while, because I didn't understand that when you're, I didn't understand that when you're really in love with somebody, that they don't see that stuff, or they don't even think about that stuff. Now I am in a dating relationship, and I've been dating a gentleman for 10 months, and I got diagnosed with endometrial cancer a few months ago, had to do extra surgeries. That's a whole nother story for another video. And this guy has walked this whole journey with me, been so supportive and encouraging and loving, and about to embark on chemo in January, and he's right there with me. And so the worries that I had in my 30s were that because of all of this, that the scars and everything, that I would never meet somebody and feel that kind of love. And now at 40, I've learned that that's not the case. Our beauty doesn't come from our physical appearance. Our beauty comes from our internal. And the other aspect, I'm a Christian, and now, during that time, I really did struggle with it. But now at 40, I look back and think, I'm a child of God. I was created by God. I'm loved by God. And that makes me beautiful. And so my words of encouragement are, when you look at the standard of the world today, and what beauty is, and you try to compare it to kind of what you've gone through, just remember that you are beautiful, that you are loved, and that scars and cancer doesn't keep you from being loved by the people who, really matter. And most importantly, that you're loved by God. And the scars are also a reminder of the journey you've gone on. And that the not only the journey that you've gone on, but what you've overcome. I look at the scars I have, because I'm the only one who can see them, but I look at the scars that I have, and I look at it now as a reminder of what I've overcome. Since then, I've had more surgeries because of the endometrial cancer, and I look at those scars and think they're just scars, but they're a reminder of the journey the journey that I overcome and continue to overcome, and the strength and endurance within me that I really credit to God, and that's what's beautiful. It's not fun to hear that you have cancer, and take it from me, it's not fun to hear that you have cancer twice. But it doesn't take away who you are. It doesn't take away your identity. It doesn't become your identity. It's just a temporary fixture on this internal reality. It's just a temporary moment that you will overcome. And so one word of encouragement is don't let scars and all that stuff define who you are, because you are a beautiful child of God, and you're a strong child of God, and you'll get through this.